Good morning, Jocelyn. Thank you so much for taking the time to chat with me today. I'm excited to hear more about your registration and patient access experience. Let's go ahead and get started with the questions for the interview. So if you could talk to me just real quick about your patient registration experience and the number of patients you've registered in one day, that would be wonderful.
Yes, I have experience with the scheduling, payments, invoices, insurance verification. I would say I register close to 60 patients a day, whether it's setting them up for appointments, different trainings, getting their demographics, or anything like that, adding things to their medical file.
Wonderful. Thank you so much. And then tell me about your experience specifically with insurance verification, maybe some of the insurances you've worked with, and if you've had to talk to patients about their financial responsibility.
Yes, so I dealt with Medicaid, Medicare, and Blue Cross Blue Shield, Cigna, and some patients that come in don't have insurance. So we set them up with different financial aids. For example, people with low income, we know that they are not able to pay for it. So we'll make all of their appointments or any training, they'll only have to pay 10% of it.
Okay.
For example, if something was like $300, so they will only pay $30 so they can still be able to get the service they needed.
Okay. Wonderful. And then when you think about how to identify if you're talking to the right patient, what's an example of 3 patient identifiers?
Their date of birth, their address, and their social.
Wonderful. And then which medical and healthcare softwares have you worked with?
I've worked with Epic, I've worked with CMD and CRM.
Wonderful. And then how do you, in your previous positions, how have you ensured that all necessary patient documents and forms are completed accurately and promptly?
I do one thing at a time, so I enter all of the information in, get everything I need set up, and then close the file. I don't try to handle more than one client at one time because it's confusing. You might enter things in the wrong way. So I just do everything step by step to make sure everything is completed.
Wonderful. And then describe your interaction with other healthcare professionals, maybe with doctors, nurses, or other staff within the office.
I do one-on-one communication with most of the doctors and nurses that I've had. We start off with email, but if specific things need to be done, I just speak to them one-on-one so we can make sure any patients or clients are taken care of.
Wonderful. And then tell me about a time you had to deal with an upset patient. What was the specific situation? How did you handle it? And then what was the outcome?
Yes, so working at the Center for the Visually Impaired, I had a patient that came in, but they came in on the wrong day for their appointment. We let them know they were in on the wrong day. They were upset. Of course, we understood. So I went and spoke to the doctor one-on-one and just asked them, hey, we have a patient that is here. The appointment is not today, but they need help today. Can we squeeze them in? And the doctor let me know if I was able to get all that information put in that he will squeeze them in. And then once I went and talked to the patient and let them know, hey, we're going to get you, and they calmed down because they realized we did care, and that we weren't just trying to push him out the door. So they were happy about that.
Wonderful. What does customer service mean to you?
Customer service, what does it mean to me? It means being understanding, having empathy, talking to people as if they are a person and not just, a number because you're just going through work. It's easy to just keep going, but just being understanding and helping them in any way they can.
And then how do you feel like if someone was already dissatisfied, how would you help improve their experience?
If someone was already dissatisfied, I would just try talking to them. Usually, once a patient or a client is upset, Usually you just go in and talking to them what calms them down and just ask them what the issue is and try to fix it to the best of my ability.
And then what would you do if you didn't know how to help a customer or patient?
I would just go to my head up, whether it's me going to another coworker or a manager to try to get the answer to a question I did not know. Usually somebody around you in your circle has the answer, so I would just go and ask and then bring it back to the person that needed the answer.
And then what skills do you think a great customer service representative should have?
Um, Definitely great communication skills, um, skills in technology with the computer, being able to use everything that I need, being dependable, um, being loyal, flexible to do anything that's needed.
Wonderful. And then obviously some tasks within patient access and patient registration can become repetitive. When you're in a position like that, and I'm sure you have been, how do you stay motivated?
I stay motivated by helping people in the job that I'm doing. I know me just getting the information is helping them to get seen or getting taken care of. So I'm motivated to just keep going because I know in the end somebody is getting helped. And doing the same thing over and over. I'm a person that likes a creature of habit, so doing stuff over and over wouldn't bother me at all.
Wonderful. And then what are your strengths and what are your weaknesses?
Um, I would say my strengths are communication, teamwork, um, being flexible, being compassionate, and having empathy for others. Um, I would say areas of weakness or improvement. I would say delegation. I'm a person that takes on everything of like, I'll do it instead of letting other people, do it. I just want to make sure everything is done correctly. So I would say delegation, handing things off to others so I won't take on too much.
Perfect. And then where do you see yourself in 5 years?
I see myself at a job where with stability that is something consistent. Um, if I were to get this position, I would still plan on being a will star in the next 5 years.
Wonderful. Well, I appreciate the time, Jocelyn. I will stop the recording and you and I will wrap up.